Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, urgent care, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is the trans TMS, which is a form of electromagnetic therapy for the treatment of number of diseases and all that. Joining us today as our guest speaker is Dr. Pranav Jagtap, and he is a psychiatrist in the local community, and he's treating lot of patients with all these new formats of therapy. He will tell us the details about this whole thing. Good morning, Pranav, and welcome to my show.
Good morning. Thank you for having me here, Dr.
Yeah,
Prasad.
I'm very happy to have you because whatever you are doing, in your clinical practice, that is something new, and I don't know too much about this, to tell you the truth.
Okay.
So, will you please first give your introduction to our viewers?
Yes, absolutely. So, as Dr. Prasad introduced me, I'm a psychiatrist, and I'm a Michigan native. I've spent most of my life
Oh,
here. Yes.
in Michigan.
Yeah, over 25 years coming up now. And
Okay.
so I did my undergraduate studies in Detroit and my medical training in Detroit. And then I went on to do my specialization training in Detroit as well.
Okay.
Yeah. And then I've been practicing here for the last
Yeah.
5 years in Bloomfield Hills.
Okay, so you are a pro. So first of all, you tell us about what is the transmagnetic and the brain wellness. How are they linked?
Yes, absolutely. So, transcranial magnetic stimulation is a kind of therapy for the brain that sends magnetic waves through the skull, and it gives the nervous system energy to do what it naturally is supposed to do, anyways. If you can think, very, very simple way to think about it, right? So,
Okay.
for example, when we're thirsty, we drink water.
Right.
And what does the body do with the water? It uses it in the best way that it should use it, isn't it?
Right, that's
So,
true.
yeah, it's the same thing with this therapy. We just give the nervous system energy, and it
Okay.
uses it in the best way that it knows how to do, because that's what it's configured to do.
So it
So-
boosts up our nervous system.
Yes, exactly.
It's the brain.
The brain and the nervous system. And what happens is the nerve. So I see you're drinking a cup of coffee,
Right, yeah.
So why do we drink coffee? Is to kind of bring our nervous system up to a certain level of alertness, isn't it? So similarly, our brain is like that in many ways. It's either not alert, or it's too alert, too jittery.
Right.
So when we give it energy with the TMS therapy, it brings the system back closer to equilibrium.
Oh, so that's good. So TMS is a form of electromagnetic therapy,
Yes,
right?
exactly.
Okay, yeah. So now tell me, who are the candidates?
Yeah, so the candidates are anyone who is looking to have brain wellness, right?
Okay,
Yeah.
brain wellness.
Yes, and by brain wellness we mean you just want to feel better, right? You want your brain to function
Yeah.
better, yeah. And that includes anybody with so the therapy has been most widely studied for depression, okay? But there's a lot of data. People believe, well, you said earlier that it's a new therapy, right?
Right,
But
yes.
but you won't believe this. It has been around since 1985.
Is that so? Since 1985?
That's almost 40 years now, right?
Yeah, right, yeah.
So it's been around since 1985.
Yeah.
And over that time, we've had all kinds of studies done for depression,
Depression,
PTSD,
yeah, right.
ADHD, anxiety, dementia, chronic pain,
Right.
and even neurological conditions
So,
as
in
well.
other words, the therapy has been there for our viewers to know for a long, long time.
Yes.
It's just that the modalities of treatment were not as good before as it is now, right?
Yeah, we've come
Because
to learn.
those days, I wrote many articles, I gave lectures about the winter blues, holiday depression, seasonal affective disorder. But there was no documental fact like this one to stimulate the brain.
That's right. Yeah. A lot of new research has come around
Research
in
has
the
come
last
out,
10,
right?
15 years, I would say. Like you're
Yeah, right. So now you know what, since this is the holiday season, let us concentrate about the holiday depressions. Can you talk about that, how this helps with the holiday blues, the sleep?
Yeah, that's a great, I think, idea to
Yeah,
discuss that because many people are going through the holiday blues right
right.
now.
Yeah, right now.
Yeah.
Yeah.
What happens, is the reason people suffer or have a holiday blues, we call that seasonal affective disorder,
Right.
in the
Yeah,
season,
yeah,
is
yeah.
because the amount of sunlight we're getting
It's,
goes down
yeah.
significantly, isn't it? Lots.
Right,
Yeah.
right.
And that disrupts the circadian rhythm of our system, of the endocrine system is disrupted and the nervous system is disrupted. So what happens with the TMS is that the brain gets energy and it
Okay.
shifts the system back closer to the equilibrium. So
Yeah.
what I mean, you've seen seasonal affective disorder quite a bit
Of
in
course,
people,
I
right?
have seen
Yeah.
a lot of them, and I even, when I was writing that one article which was published in some journal, I even went to the shop to say what are the different kind of lights they had. At that time, you do it with the light.
That's right.
But now you are more sophisticated. Now you do it with the current.
Yes, because the light is supposed to stimulate and wake the brain up, right?
Right, right,
And
yeah.
when the holiday blues, picture this, right? So you want to do something, but the energy just isn't there. There's a fatigue,
Fatigue.
low mood, emotions aren't there, difficult to focus, grogginess.
Yeah.
All that stuff can be reversed with this technology. And you won't believe it. How long do you think it takes?
Probably, I mean, I would say, like it's a jump start. Like when you take the car to the servicing and they will do a jump start. So that's what it is. You're jump starting the brain, right? In simple words.
Yes, you're jump starting it, but one important difference when you go to the car, right, with the garage,
Right.
they have to stop the car, they have to, open some parts up,
Yeah,
like we
yeah.
used to do back in the day with electroconvulsive
Right,
therapy. Here,
right, ECT, yeah.
yeah, but here we're almost like switching the gear while the car is already driving, so there's no problem to the
There's
person.
no problem. Yeah, right, yeah. So, you know what, interesting, so many articles have been written about this. I did not know till I have you as a guest speaker. And then I said, oh my God, I have to know about this before I have you. I like to prepare myself. But it is amazing, the structure of brain. They have given cerebral cortex, thalamus,
Yes.
how this stimulus goes. Can you comment on those? I know without slide it is hard,
Yeah.
but maybe next time we will add some slides to see.
Yeah, that could be a good idea. But very generally, when we're talking about holiday blues or depression in general, what happens is in our brain. Well, you've seen a person who's depressed
Sure,
sometimes.
sure.
They're usually in their own mind. They're difficult to get out of past thoughts, bad memories,
Right,
difficult
right.
to stay engaged.
Exactly.
So what's going on in the brain is in that person, there's a brain network called the default mode network. Okay.
Ye- Yeah.
Yeah, because your mind is at default. It's just mind wandering,
Deep-
ruminating,
right, yeah.
and it's too active. So what the TMS does is that it stimulates the prefrontal cortex up here.
Yeah, is it the right side or left side?
It's on both sides, but
Both
with this
sides.
we do it on the left side. Okay?
Left
Yeah,
side.
so we do it on the left
because
side.
of the Purkinje, because of the fibers,
It's just because on the left side, what happened is
cerebral cortex. Yes.
yes, that's related.
Yeah,
and,
yeah.
And it's the logical part. They say logical
Sure, yeah,
side. So we
yeah,
stimulate
okay.
that, and as that area gets more active, the default mode network gets less active.
Okay.
So the
okay.
mind wandering goes down, the
Mind-
bad emotions go down, and you become more engaged.
Yeah.
Yeah.
So, I wrote a couple of years ago articles about what grows in the mind of, somebody like a shooter, or at that time, there was all these shooting incidents
Yeah.
going on in Michigan and all those. Amazing to see how, how the DOCA, how this part, hypothalamus, thalamus area controls the whole thing.
Yeah, the thalamus is
Thalamus.
very important. I actually researched the thalamus when I was doing research at Wayne State
Yeah,
in
okay.
brain imaging. And the thalamus is responsible for relaying all kinds of information from the environment to our consciousness, really, to our
Yeah,
prefrontal
right.
cortex.
Yeah,
Yeah.
yeah. So that's how hypothalamus, controls the passage of the sympathetic fibers and all the.
Yeah, so that's a good point you bring up because the
Yeah,
TMS can
right.
help
Yeah,
us to change what information is being valued, right? You
right.
want the
Yeah,
good information to be valued,
yeah.
and the other bad information that's holding you back, you don't want that to be valued.
No, and this the little area in the cerebellum below the cerebellum hypothalamus. There's a name I'm forgetting the name. Can you think about it?
The
The
are you talking about the suprachiasmatic nucleus where the
supranucleus,
yes.
where the whole thing is, the hypothalamus, below the hypothalamus
Yes,
area.
yes, yeah.
So that gets stimulated.
Hypothalamus also gets stimulated, and
Right,
that's
yeah.
really important you bring up because that's where, you must know about cortisol, right?
Yeah, yeah.
Yeah, very important hormone, right, for the holiday
Cortisol.
blues. Yeah.
Right, yeah. Yeah.
And when we're really chronically stressed, the cortisol is too high.
Yeah,
So when we
right.
do the stimulation with TMS, the cortisol levels also go down.
Goes down.
Yes.
Right. Because cortisol, those are the bad fibers that stimulates the cerebrum to do inactive behavior and so this EMT, that suppresses those. Yeah.
Yeah, like you generally remember the principle we talked about was sometimes
Yeah.
if it's too active, it'll bring it down. If it's
Bring
less
it.
active, it'll bring it up.
Yeah. Right.
But for the holiday blues, really important part is the sleep is also off, right?
Yeah.
And the sleep is off because the sunlight is not there. And what happens when we go to sleep? The melatonin level goes up.
Yeah.
And when we wake up in the morning, the serotonin level goes
Yeah.
up, right?
So anyway, very interesting story. Now I remember it is amygdala.
Amygdala, that's right. That's the danger
I was
center.
trying.
Yeah.
So we went to Chicago, with our families, their children, grandchildren. So one of my grandchildren's pre-medical student, he says, Dr. Prasad, how does amygdala affect the whole situation, hyperactive? And to me, at that time, I did not remember amygdala. I didn't want to make him feel that I'm ignorant. When I came back, I took a textbook of an anatomy that we have back in medical school, Grant's Human Anatomy. You probably
Yeah.
read the same thing.
Right.
And then I studied about this little thing, amygdala.
Yeah.
And now I remember. So, but at that time when he asked me, I didn't know because I forgot.
Right. Yeah. Okay. So the amygdala is the.
Amygdala, yeah.
It's like an
So
almond. I remember almond, and I remember.
it's an almond
yeah,
shaped, right?
That's right. Yeah.
So that's what he was asking me, Dr. Prasad, what is the mechanism? So I said, hey, look, when I go home, I will write. I didn't say I didn't know. I said, I will write you a whole thing. So then I sent it. I sent him the whole tissue and he was happy.
Wow. Okay. I'm sure he learned a lot about the amygdala then.
I know
Yeah.
because it was haunting my brain.
Yeah.
But so long, where the graduates of way back when, what do I know about the recent thing? But the anatomy, that anatomy book, thick anatomy. You probably, which book did you guys read in medical read?
We had the Netter's anatomy
Oh.
plates, and I think Grant's was also there, but I remember it was Netter's. Yeah.
Oh, okay, yeah. So I read the whole book. I still
Yeah.
have it in
Okay,
my
very
life. And I always remember, electromagnetic. It is a little almond shape.
Yeah. The other region near that is also the hippocampus, right? That's actually the memory center.
Amygdala and hippocampus.
Yes.
Because hippocampus is for memory,
That's
right?
right.
Okay.
Yeah. And the amygdala is for dangerous information.
Dangerous thing, yeah. So
Yeah.
that's what happened. And they will shoot out the bad
Yeah.
thing and the hippocampus through the cerebral, they control.
That's right. If we're getting bad information all the time, threatening information, it'll go to the amygdala,
Yeah.
And then we see this in PTSD actually, and anxiety all the time,
Yeah, right.
hyperactive.
I was going to ask you about the post-traumatic. Yeah, tell me about this to our viewers.
Yes, so post-traumatic stress disorder, happens when somebody's had a very traumatic event.
Right.
And behaviorally, we see all kinds of things like people are on the edge all the time, might get nightmares, flashbacks,
Right,
difficult to focus. It's just anxiety on hyperdrive. Sometimes there can even be panic attacks, right?
Yeah.
But in the brain, what's going on is that the amygdala is very active, too
Very
active all the time.
yeah.
And it's also connected to the hippocampus, right? So all the negative memories are also being activated, and the brain can't think. It's like the brain is hijacked by itself.
Right.
So with the TMS, we reverse the hijacking.
Reverses the
Yeah,
hijack.
and there's no side effects.
Yeah.
Isn't that great?
So that's good. Is there no side effect also?
Very, very little side effects, if anything.
Oh, okay.
Yes.
So then I like to ask you, who refers you the patient? Where do you get the referrals for this?
Usually it's word of mouth.
Word of mouth,
Yes,
okay.
sometimes it's through social media. I mean, I've started to put out educational content as well. Yeah.
Yeah.
Those are the two methods.
So that helps, educational content. So.
It does, but I think usually, because this is new,
Word of mouth.
the
yes.
community, it's best to spread out that way, word of mouth in the community.
Yeah, right, yeah. So that how long when the patients go to you or how long what do they expect once they go to your office?
Yeah, so when patients come, of course, we'll have a talk, right? We're not just going to sit in the
Of
chair
course.
right away.
No, no.
Right, yeah.
How long do you, the whole situation, by the time patient goes plus the therapy, do they give themselves like 2 hours?
Yeah, around like 1.5 to 2
One
hours,
and
I
a
would
half,
say, because we want to get a thorough, background
Right,
and
right.
make sure we're
Yeah,
doing it
yeah.
the right way. Yeah,
Okay.
because you don't want it to backfire, right? That's the
No,
other thing.
no, no.
Yes, yeah.
So they go there and you get the history and everything. Of
Yes.
course, you eliminate any precipitating factors like diabetes, blood pressure, and all those, right?
Yes, and I mean, we have to screen for that. And you won't believe it, but the therapy will also help to reverse some of these things.
Is that so?
Yeah, but it's not magic. I'm not going to say it's magic.
No, it cannot
Yeah,
be a man.
but what it does is that, let's say you have some intention, right? You really want to get better,
Right, yeah.
and something's getting in the way. This will kind of amplify your efforts and really help you overcome that little resistance. When I say you, I don't mean you, Dr. Prasad. I mean
Right, I know,
in
I know,
general.
I know what you mean.
Yeah.
So they will go, and the whole procedure with the EMT lasts about. The actual procedure is how long? 30 minutes? Or?
Yes, 20 to 30 minutes is what
20.
I see. Over the past 5 years, I have really come to understand it and study it intimately. And I've realized that the 20 to 30-minute mark is
It's
when
more than enough.
yeah, especially the first time. That's when we get that jump start metaphor we talked about, right?
Right.
Yeah.
And also, can you comment about the helmet? They wear helmet and
The helmet
I
is...
read it and I don't even remember where I read it about
Yes.
what is the role of helmet?
The helmet is a different special form of TMS. It's called
Okay.
deep TMS, okay?
Okay.
It's similar, but
But it's a deep one.
yeah, it works a bit differently, and that's what the
Okay.
helmet is for, so that it can go deeper into the brain.
Okay.
Yeah, when you come to my office, there's no helmet. You just sit in the chair.
Oh, no. You
Yes.
just sit on the chair.
Yeah, you sit on the
and
chair, and we place the coil over the prefrontal cortex, which is a very
Okay.
big area, right? So we just
Okay.
need to activate it.
Okay.
Yeah.
And helmet is because I read about the helmet also in one of the, I don't know, but a British journal or
Maybe next time we can talk more about it then.
about
Yeah.
the role of helmet.
Yes, yes,
We can do that.
Definitely.
So today we are talking about the role of this electromagnetic therapy, mostly for holiday blues, and for the depressions among the children, adolescent.
Yes, right.
Yeah.
Especially important in that population, right?
Yeah,
Because
yeah.
I don't. I mean, nowadays there's a lot of talk going on about the standard treatment for that population and how it might have side effects that we didn't really know
Right,
about,
yeah,
right?
yeah, yeah,
So,
Robert.
I mean,
We don't want to go into detail about that
that's right.
one.
That's right.
Today we are just simple electromagnetic therapy.
Which is great for that population. That's what we'll say.
Right.
Yeah.
And also we can include, like, the bottom line is winter depressions, anxiety, and all those things that is happening out. About all this shooting and all this.
Yeah, yeah. That's the thing is
Isn't it terrible?
horrible, and I think this is one of the therapies that can really help with
That helps.
yeah in that
That
situation.
helps, yeah.
Every week almost we see.
Every week, is amazing. Yeah, last night also. But last night I couldn't go into detail because I was sick myself with cold and allergies and all that. But
Oh
that
no.
is a good. This is a good review, and also for the post-traumatic syndrome.
Yes, and
PTS, do you want to say something about PTS? Yeah, you
Yeah.
said already.
yes,
yeah.
sure. But
With the athletes.
yeah, just to close the loop out with the PTSD, right? To your
Right,
point,
yeah.
what happens? One of the things that we've really learned, very cool. Okay, when you come, if you come,
Yeah, yeah.
I'll have you wear
show
an
you.
I'll have you wear a watch which measures the heart rate.
Okay.
So when we do the stimulation, the heart rate goes down.
Oh, really? Okay,
Yeah.
okay.
And that's because it's connected with the vagus nerve to the heart.
Vagus nerve, yes. So,
So-
it is a vagus nerve stimulates the heart rate goes
Yes.
down.
So if somebody has anxiety or PTSD, right, they become calmer, and at the same time, we also reconfigure the thought patterns that are bad, and turn them into more favorable thought patterns.
Right.
Yeah, and that's how it helps.
And do you make them think like dreaming something, that they are in the
Well, kind of. It's
pleasant dream?
exactly. It's taking a bad memory
Bad
and then
memory.
transforming it into
Right,
something,
yeah, right.
something positive, right? Something
Right,
favorable.
something positive. So
Yes.
that's good. It should be good during the holiday seasons. And also,
Yeah.
is there any difference in modalities of treatment between adolescent group, adults, and the senior citizen? Do you see any changes in the modalities, or is the same?
You know, I use it the same parameters.
The same parameters.
Yes, but the therapy is different, of course. See, I'm a psychiatrist first, right? So we
Sure.
learn psychotherapy. You know how psychotherapy is
yeah,
individualized
psychotherapy.
for each population. Same thing.
Subjective and objective.
Exactly. So the objective part is the parameters of the TMS, and the subjective part is what we're working on specifically for each person.
Yeah, yeah.
But I'll tell you though, in the elderly population, polypharmacy. People tell me.
I
all the
know,
time.
I'm telling you that polypharmacy is something, I have another article
Yes.
written about polypharmacy from my personal experience while I was working in emergency room.
Then you know so much about it.
Right, yeah, yeah.
People don't like it, I think, right? They don't.
No,
yeah.
they don't, yeah.
So this is a nice alternative then. It can help
Yeah.
with
The
pain.
emergency room, around midnight, there was a triage. Somebody, senior citizen lady, broke her thigh, comes emergency room, and then, we orthopedics got involved. A busy emergency room. What are the medicine pills you are taking? She took out the whole bunch and put it.
That's a lot of pills. Yeah.
And night time, it's very hard to get hold of the pharmacist too,
Right.
what is what. So that was a bad experience. Next day, the pharmacist took care of all that. I said, don't take any of those pills. Wait till tonight. Be healthy.
Yeah, and oftentimes, there's a caregiver to give the pills. What if you take more than you should? It can be a bit of a problem,
yeah,
right?
yeah.
So
Those are the polypharmacy. Do you think it is getting less now, this with your clinical practice? Do you see that polypharmacy still is a major issue?
I think that the TMS can definitely help drive down the need for polypharmacy.
Okay,
Yeah.
so there is definite role of TMS
100%, yes.
for the polypharmacy.
Especially for sleep, right? Oftentimes what people report is we do
Yeah.
the TMS and they sleep so restfully through the night like a baby.
Yeah.
Deep restorative sleep.
Yeah,
Yeah.
right, yeah. And the melatonin, would you comment about the melatonin?
Yes, so melatonin is supposed to go up at night and serotonin goes up in the
Melatonin
daytime,
level,
right?
yeah.
But like we discussed in the holiday blues, there's too much melatonin at night
Too
because the
much,
nights are
yeah.
long.
There are side effects now, I read,
If you take the pill,
of the
yeah.
melatonin also.
Well, this is the natural way to do that, right? It's a natural way
Right, yeah.
to shift the system back to equilibrium.
Yeah, so anything else interesting thing you would like to talk about?
You know,
That-
Dr. Prasad, we can keep talking and talking. So what I'll say is we'll close the loop this way, okay? There's very important thing that I think
Sure.
people
Go
need to
ahead.
learn about the TMS is that it's very, very critical that you use the TMS with the right person, okay?
Right person.
Yeah, because the person there is important. They're the ones who are going to conversationally activate your brain networks or deactivate certain ones to make sure you get the most out of the therapy.
Right.
Yeah.
Yeah,
Out of
that
the
is very
TMS.
important
Yeah.
because every psychiatrist cannot do that, right?
Yeah, that's why if you look online, there's a bad
Yeah.
reports about the TMS sometimes.
TMS, right.
And that's
I
because it's not being done the right way, you know.
Right. Yeah, one time I had a guest speaker from your group. We talk about the autism spectrum disorder.
Yes.
Do you once in a while get a patient like that, ASD?
Yeah, I've actually seen autism, and there's a lot of data on TMS
So
for
next time we
autism.
can talk about that also because that's such a common topic these days.
Yes.
Autism.
You know, we can talk about all the different disorders because the TMS helps with all of them. It's just how we use the tool
Tool,
to
right.
change the brain networks.
Yeah. So this is very good. Today we talked about the general role of electromagnetic therapy, TMS, which is a form of electromagnetic therapy with our guest speaker, Dr. Pranav Jagtap. He is a psychiatrist and a pro in this issue, in this problem. And I'd like to thank our viewers for watching this great show. Something about very new and more, it is benign. It doesn't have any too much of side effects either. And during the holiday, we are talking about how you manage the holiday depressors, the winter blues,
Yes.
and I like to thank our producer for helping me produce this show. And until I see you guys again, have a very safe and a wonderful holidays. Thank you again.
Thank you for having me.
Yeah, they're showing me.